Hello everyone, this is Chadi Alraies from NCVH 2025. I'm really privileged to be with Dr. Mohammad Ansari, who has been like a frequent guest for us on the TV, as well as well-known faculty for the conference and other cardiology conferences. Mohammad, thanks for being with us.
Yes,
it's a very important topic we're going to talk about, which is the importance of endovascular training for fellows, whether interventional fellow, 3-year, or an advanced training. So tell the audience about like the importance and the gap.
So I think my emphasis was that 1 year of interventional training is not enough. You need to do more because you could just master the coronaries in that 1 year, and even that is difficult. So peripheral vascular is a completely separate topic, and usually the best thing would be, of course, to go for an extra year of training that I did, and it was greatly helpful because you can see all aspects of peripheral vascular training. But that is there are very few limited spots. There's not much funding for that as well. So there's a huge gap in there. And then because of COVID also, that people cannot master that training as well. So it's been a gap in cardiology towards peripheral vascular. So the move forward towards it depends really on industry and industry-derived courses that are there, and actually the conferences. The conferences are every major conference, AMP, NCVH, Viva, they have sessions for fellows. And I think it's very important if fellows are consistent and attend that in a row, in a sequence, because then what it will allow them to see different aspects of modules of learning on different aspects of cases and different aspects of devices, so they can have their hands-on approach towards, because everything is merged with hands-on workshops. And I think that is very important because it will allow them to have a utility of different various devices that they have, and to learn the aspects when they talk about case series and stuff. Unless that is done, then it becomes very difficult to master peripheral vascular interventions.
So from what I'm hearing from you, that there's a lack of endovascular trained physician in the community to serve the patient and the burden of the disease of PAD.
Yeah, the burden of disease is humongous. I mean, I was at Texas Tech and now I'm in Houston, and within few months I'm super busy just because of the burden of the disease that I've seen. The issue is this, that the disease is growing and the population taking care of the disease is getting less because there are fewer training programs, there's not much funding for them, and who is going to come up with this taking care of the gap, and because of COVID, when there are less cases being done, those physicians that were graduated didn't have sufficient volume to be trained. So this gap is humongous, and it has to do something to come up with, to deal with, and where the associations have to step forward. SCI and ACC, AHA come up with a plan. Unfortunately, I don't see anyone coming with a plan.
Absolutely, yeah. Especially as you said, 1 year is not enough. They barely make it to do the coronary training. So adding endovascular, like to be the master of endovascular, is going to be hard. So maybe, as you said, industry-sponsored courses and stuff that can be kind of complemented primarily before they go.
I think it has to be both. Industry has the main way to play in this, but also associations as well. With the NCVH coming up with the NCVH Fellows course, AM coming up with the AM Fellows course, I think these are greatly helpful because they're teamed with workshops. And these workshops gives a hand-on approach to the fellows, because no matter how many lectures you give, unless you have your hands-on devices, it's very difficult to learn these things.
That's true, yeah. Well, Mike, thanks again for giving your input on the importance of endovascular training for fellows, and also to provide a community with well-trained physicians to treat PAD.
Thank you, Aaron. It's a pleasure.
Watch the videos and others on YouTube channel. This is Chadi Alraies coming to you from NCVH 2025 in New Orleans.
Thank you.
Dr. Ansari, thanks again.
Pleasure.
Thank you.